We've reached the midterm of our Phase 2 heightened alert and undertaken a review of the measures as we said we would. And so far, as you heard, the clusters are under control. Because of the higher transmissibility of the Delta variant, it's been more difficult for us this time round to bring cases down, as we had before. But what's important is we have been able to prevent a surge in cases, an exponential and uncontrollable surge in cases that could potentially have overwhelmed our healthcare system. That was the scenario that we were very concerned about when we saw the outbreaks in our hawker centers and wet markets all over Singapore. And fortunately, we have been able to avoid such a scenario. Overall, hospitalization and ICU cases remain low and stable. And importantly, we have used this time, as you heard just now, to vaccinate many more people in Singapore, especially our seniors. And that's why, after looking at the overall situation, we believe we are able to now ease some of the restrictions, especially for those who are fully vaccinated. And so from 10th of August onwards, fully vaccinated individuals will be able to gather in larger groups of 5 persons. They can go out, they can visit one another in a group of 5. We will allow for larger event sizes if they are attended by only fully vaccinated persons too. So worship services, cinemas, MICE events, live performances, sports events can go up to 500 persons if they are attended by fully vaccinated persons. Wedding receptions can go up to 250 persons, fully vaccinated. And we will allow fully vaccinated persons to engage in higher risk mask-off activities. They can go out to a gym, fitness center. They can dine in an F&B outlet in a group of 5 persons, up to 5 persons, all fully vaccinated. Children below 12 can join in the group of 5 persons for dining, so long as they are from the same household. We will extend a special concession for hawker centers and coffee shops because these venues provide convenient and affordable food services for many Singaporeans. They are open-air venues with natural ventilation. So we will allow both vaccinated and unvaccinated persons to dine in hawker centers and coffee shops, regardless of your vaccination status, in other words, but it will be subject to a smaller group size of 2 persons. And this concession is only for hawker centers and coffee shops. Earlier, we had announced a package of support measures for Phase 2 heightened alert that extends throughout the 1-month period up to 18th of August. Despite this midterm easing, we will continue with the support measures as was announced. There will be no change in these support measures. So what I've just described are the changes that will take place in the first step from 10th August onwards. From 19th of August, if the pandemic situation remains under control, we will consider further easing. For event sizes, we are looking at up to 1,000 attendees, from 500 to 1,000 fully vaccinated. Operating capacity of public venues like museums, libraries, attractions, and cruises can be raised. Likewise, capacity limits for shopping malls can be raised. Work from home requirements will also be eased, and we will allow up to 50% of those who are able to work from home to return to the workplace. So these are the next step of easing of measures that will be considered from 19th August. We are easing restrictions for vaccinated persons to engage in more activities across a range of different settings. It is equally important for those who are working in these settings to be vaccinated. So for example, we say F&B dining, only vaccinated persons can dine. It's equally important for the person who is working in F&B to be vaccinated. So we will introduce a new vaccinate or regular test requirement for people who are working in specific settings. They include 1, those who are working with vulnerable segments of the population like healthcare, elder care, or settings with children below 12 years old. as well as those working in higher risk mass-off settings like F&B, gyms and fitness centers, as well as our border checkpoints. Under this new requirement, those who are working in these settings will have to be vaccinated, fully vaccinated. If they are not fully vaccinated, they will have to be tested with an antigen rapid test twice a week. This will help to protect them, their colleagues, and the people they serve in the course of their work. We will allow individuals time to get vaccinated. So this new requirement will take effect from 1st of October, which means that individuals in these settings who have not been vaccinated yet can get themselves vaccinated between now and end September. The public sector will take the lead and set the example. We will introduce this requirement for all public offices. The vaccination rate is already very high across the public service. More than 94% of our officers are vaccinated. And we will continue to encourage those who have not done so to get their jabs. And then for those who are not vaccinated by 1st October, this new testing regime will apply. There are obviously details that have to be worked out. I've set out the broad framework for this new vaccinate or regular test regime, and details will be released by the specific agencies in due course. Finally, as you already heard just now, we are and will continue to adjust some of our border measures. We are doing two things in August. From 10th of August, we will start resuming entry approvals for fully vaccinated work pass holders and their dependents to enter Singapore. We had throttled down these approvals over the period of heightened alert. But now that we have reached a higher level of vaccine coverage, we will start to adjust our border measures and we will resume entry approvals for such fully vaccinated work pass holders and their dependents, subject to prevailing SHN requirements. Next, from 20th of August, we are allowing more fully vaccinated travelers from certain countries to opt out of dedicated SHN facilities and serve their 14-day SHN at home or other suitable accommodations. It's just useful to take a step back. Remember, we have a tiered system of border measures. We classify it based on the risk levels of the country of origin, source countries. So if the country is very safe, low risk, we have unilateral opening. For the next level, we require travelers from those countries or those places to serve 7-day SHN, or they can do this at their place of residence. And then the next level is somewhat higher risk. They come in and they have 14-day SHN in a dedicated facility. Now, from 20th of August, we will identify a group of countries which have risk levels which are acceptable to allow travelers from these places to serve the 14-day SHN at home as an option. And the full list of countries will be put out in the press statement. We have laid out a series of moves which will take place over the month of August. This is what we call, as Minister Ong said just now, the preparatory stage. And beyond that, when 80% of our population are fully vaccinated, we will move to the transition stage and allow further easing of measures. We are taking a controlled, step-by-step approach in reopening. Each time we make a move, we will monitor the situation closely, ensure that the number of severe illnesses is under control, that our healthcare capacity is not overly stretched before we take the next move. So we thank everyone in Singapore for your cooperation in this journey. We seek your continued cooperation with us as we work towards becoming a COVID-resilient nation. Thank you.